I'm Dr. Jonathan Clark. I'm a board-certified chiropractic neurologist, and we're going to talk about the tools we use, such as non-surgical spinal decompression, to help with a chronic spinal complaint. So again, non-surgical spinal decompression, this is a new FDA-approved therapy to help treat herniated, bulging, and degenerative discs, along with what we call spinal stenosis, or narrowing of the spinal column. The American Journal of Pain Management stated that 86% of disc patients achieved good to excellent results with spinal decompression. So what exactly is going on when we have a herniated disc, or a bulging disc, or stenosis, or a pinched nerve, or sciatica? Well, number one, it's painful. I think you can experience that, and I think you know firsthand. But if we look and we try and visualize, if we have two vertebral segments here, then you have a pad between the joints, like so. What happens is that area, that pad, gets compressed together, and then the material kind of bulges out the side. So if you kind of think of like a moon pie and taking two pieces of the moon pie, the top and the bottom, and squishing them together, and the cream kind of bulges out the side, it's kind of similar to that, obviously, if you use your imagination a little bit. So this obviously leads to extreme pain and immobility, as you know firsthand. If it's in the neck, it can obviously affect the neck joints and the neck pain, the muscles that surround it. And if it's bad enough that it affects the nerve root that passes out in between those joints, then it can lead to numbness in the shoulder, into the arm, into the hands and the fingers. Obviously, if it's in the low back, that's going to lead to low back numbness, into the thigh, down into the toes as well. So what does non-surgical spinal decompression do? Well, basically, it takes these areas and very simply opens it up. Okay, so it's a computerized device that distracts the area, compresses, distracts, relax, distract, and relax. This computerized device creates that negative pressure in the disc to force the material back in to be contained. We've even used this on patients after unsuccessful surgery in certain cases. So the next question I get then is, well, does this hurt? And that's really the greatest thing about it, is most of our patients fall asleep during treatment because of how relaxing it is and the great results we get with it. Another thing that we use in conjunction with the non-surgical spinal decompression is what's called the ATM2 device, or Active Therapeutic Movements Device. This helps restore core motion impairments. When many people have heard of their core muscles, or you have a breakdown in core control, what that basically means is the muscles that surround the spine are called your core muscles, or some of the core muscles. They're controlled by an area in your cerebellum, back in here in part of the brain, the paravermal region, and that basically tells those muscles what to do. So in a chronic spinal complaint, the connection between the muscles and the brain gets messed up. This helps reactivate that connection, and this can be performed on the neck, the mid-back, the low back, the hip, and shoulders as well. But oftentimes we'll see many chronic cases that can't bend forward or bend backwards or respond immediately and see an immediate increase in range of motion. And if you know anything about golf, Ernie Els is a huge proponent of this device because he's used it in the past to rehab a lot of his complaints. Another thing we use in our office is what's called a Class 4 high-powered laser, what we call Avicena laser. You can go to avicenalaser.com, A-V-I-C-E-N-N-A laser.com, to check out more about this. But basically, this is the strongest laser on the market. Laser therapy helps reduce pain, block inflammation, helps tissue heal. So we use this on hot discs, we use this on people that have radiating numbness, we use this on carpal tunnel. Does a lot for a lot of things, but primarily this helps us heal faster. So as you can see, we have the latest technology in functional neurology to help you heal and get better faster.